And then I invite Sandra to give her results on the coordination, whether coordination can play a role in understanding difference in SARS-CoV-2 testing strategy across Europe. And we will listen carefully.
Okay, so I'll give the second presentation about multisectoral collaboration and the development of the European national SARS-CoV-2 testing strategies. So it's a mixed method study that we conducted because as the COVID-19 broke out, I think at least I had just started within SHARP. I was 2 months in and this broke out, and it was an opportunity that work practices could not ignore to do research on the public health emergency while it's taking place. So we did that, and we wanted to do it while it's taking place rather than retrospectively, so that we hopefully would get some key ideas from the people involved. That is hopefully novel, that is not clouded by bias, hindsight bias. And so we wanted to investigate the role of multisectoral collaboration in the development of the European national testing strategies. So I think it is safe to say that the COVID-19 pandemic caught most countries off guard. I think it's also safe to say that most countries were overwhelmed by the amount of work, cases, and testing that was necessary. I think, at least in the case of the Netherlands, but from what I've also understood from the interviews that I held with different participants or respondents, is that most countries were unfamiliar with the concept of mass testing as part of preparedness and response. Very early on, the WHO director said that he said, and I quote, "We cannot stop this pandemic if we do not know who is infected." And he urged all countries to test. Yet, not all countries did so in the beginning. At least it took some time for most countries to get it going, and it also took some convincing even for some countries. In the beginning, also with the experience from the Netherlands, some countries were actually quite restrictive in their testing policy. So, of course, every country has the right and also the responsibility to determine their own pandemic preparedness and response. But it is quite confusing for a citizen when your country has one policy and the neighboring country has another testing policy, keeping in mind that most borders are open. So I thought it was not only relevant for us within this joint action, but also just as a societal impact. How can we improve the communication with regards to things like this when we understand why there are differences between the European testing strategies? So we hypothesize, perhaps unsurprisingly, that the differences could be explained by the different collaborating mechanisms and structures existing in the countries, or at least the lack of these mechanisms, that these could explain why the different countries had different testing strategies. We use a mixed method approach. What we first did, we conducted an online exploratory semi-structured surveys where we wanted to explore the extent to which individuals involved in preparedness and response planning, and specifically the testing strategy, described collaboration when they were telling us about how the testing strategy took place. So we used a model put forward by Perkins and all in 2017, where he states in a framework for diagnostic preparedness that can be used as a guide when trying to develop testing strategies, or at least trying to develop how to prepare in terms of diagnostics. So there are different aspects of the diagnostic preparedness. So there's outbreak detection, research and development, manufacture and distribution, and implementation in the country. We focused on 3 aspects: outbreak detection, manufacturing and distribution, and implementation. We did less so on research and development when asking the participants about their testing strategy, but we saw and expected that it was something that would come forward if it was relevant in their country. The reason why we didn't include it is because we were already in the middle of the crisis, and we thought that the research and development was not that relevant at that point anymore. So we use purposive and snowball sampling, where we invited all the joint action participants to identify 3 people in their countries that could be interviewed. So they had to be laboratory, policymakers, or public health experts that had been involved in the development and or implementation of the SARS-CoV-2 testing strategies in their countries. We conducted a total of 11 interviews between the 8th of January 2021 and the 19th of March. We conducted these 11 interviews with 12 individuals, because there was one interview with two people at the same time, and it was done in 6 European countries. We interviewed 7 women, 5 men, 5 public health officials, 6 laboratory experts, and 1 policymaker. We interviewed 3 people from the Netherlands, 3 from Malta, 2 from Croatia, 2 from Italy, 1 from Latvia, and 1 from Spain. So we have quite a couple of countries. And the interviews lasted approximately 2 hours. So all the interviews were conducted, recorded, transcribed, and coded by 2 researchers. And what we did is we looked at the Perkins framework, which I showed earlier, and tried to identify codes that could be used in a code book to actually code or identify themes within the interviews. So what I'd like to put forward is that there are actually 4 aspects of the Perkins framework that were very common when we analyzed the interviews. One was the agreements with reference laboratories for pathogen identification. So this is something that the participants mentioned quite often. One is human capacity and training on the ground. Another is case definitions and diagnostic algorithms to detect unusual illness. And the last, which was mentioned clearly very often, is coordination, accountability, and governance. So of course, we're interested to zoom into that last one. What does that mean? So there are 2 conclusions that we drew based on the interviews. One conclusion is that there are different decision-making bodies that also have different reasons, interests, and goals when defining the SARS-CoV-2 testing strategy. And I think this quotation says it quite nicely, where someone said the regions want to play their own games. Like they want to have their citizens happy. So there was like this battle. There were several tests with different types of viability or reliability, so it was difficult to control from the central level with all the regions buying their own tests. So it shows not only is it difficult to control at a central level and a national level, but then it's of course even more difficult to coordinate it at an international level, because there's so many different levels that are involved, but there are also different reasons for why they want to make specific decisions. And it's even more complicated because besides the different levels and different organizations or institutions, there are also individuals that play an important role that can really determine how the testing strategy looks like for a specific country, and that can even make that it is different than perhaps what is advised at an international level. So one of the participants said, so he was explaining how the testing strategy was actually very restrictive in their country. And then he says, until the new minister came and said, I want this to be over. I really want this to change. I think testing should be taken more seriously and we should start scaling up. And if no one else does it, we should do it ourselves and push this as a ministry. I thought this was very interesting to see that's basically, well, this one individual decided this was going to be the policy within his country, and it turned out to be the case. So then we decided to look a little bit further. So, okay, collaboration or coordination was mentioned very often, or the participants described that very often when they were describing their SARS-CoV-2 testing strategy. But which sectors are actually involved then when we look at the testing strategies? So that's why we decided to conduct online surveys to explore these sectors, which were involved in the development of the SARS-CoV-2 testing strategy. And we developed the survey based on the outcomes of the interviews. We invited European IHR focal points and extraordinary national focal points for microbiology. And we made a survey where 12 possible actors were described based on the interviews, but also on personal experience and consultations with Work Package 6. And we asked them to state whether these actors were important in the development of the SARS-CoV-2 testing strategy, and also which aspects of this testing strategy they were involved in. The survey was open between the 11th of June 2022 and then the 23rd of October 2022, and we had 15 respondents. So this slide is mostly to show, in general, which actors were mentioned often and also for which aspects of the testing strategy. I'll guide you through it. So there were different aspects of the testing strategy, namely testing symptomatic individuals within the community, testing asymptomatic individuals for work-related reasons, testing asymptomatic individuals for access to public health facilities, testing symptomatic individuals when they're trying to have access to healthcare facilities, so acute healthcare facilities. Then there's the testing of symptomatic as well as asymptomatic individuals living in long-term healthcare facilities, so for example, nursing homes. And lastly, testing symptomatic and asymptomatic animals. What we see here, that there are a couple of sectors that seem to receive more attention or were mentioned more often as being involved in the development of the SARS-CoV-2 strategy. For example, there's the Ministry of Health, there are public health officials, national public health institutions, and advisory groups. Well, this is not that surprising anymore, as these are actually the people that we saw in the systematic review that were mentioned often in the literature. So it's good to see that that is in line, but it does mean that there are certain sectors or certain actors that receive less attention. For example, animal health laboratory, which is interesting as it's becoming more evident that SARS-CoV-2 was more of zoonotic origin. So we have, for example, animal health laboratory, manufacture of testing kits and materials. You would expect that they would have played a bigger role, considering there was a big lack of materials during the SARS-CoV-2 period, and healthcare professionals and management in long-term care facilities. This is at least something in the Netherlands that became evident that they should have received much more attention at the beginning of the crisis. It's also worth it to say that when these sectors are mentioned, so those that are not mentioned that often, for example, animal health laboratory, when they are mentioned, they're only quite mentioned for specific aspects of the testing strategy. For example, animal health laboratory is mentioned for testing asymptomatic animals. That seems obvious, but I do think they could play a bigger role when defining the testing strategy for other parts of the population, as perhaps they have insights that could help define an efficient testing strategy for the whole community. So as I said in the beginning, we had a hypothesis that differences in the collaboration mechanisms and structures, or the lack of these mechanisms, could explain why European countries had different SARS-CoV-2 testing strategies. In the interviews, it became clear that the answer is that yes, these different mechanisms really played an important role on the development, the definition, and the implementation of the SARS-CoV-2 testing strategies. However, in the surveys, it is not so that we clearly saw that certain countries put forward certain organizations more often than others. So in terms of the sectors involved, that seems to be the same, but the decisions that they make or the weight that is put on certain individual actors seems to be different across countries. I think it's then important to look at how can we unify the approaches across Europe? How can we put the actors from the different countries together? So for example, the animal health laboratories from the Netherlands together with the animal health laboratories from Latvia to work together to exchange information so that if they are making quite important decisions in their country, that it's also clear why those decisions are being made and that other countries can follow example if necessary, or they can at least deliberately think about why would it be efficient, why would it be suitable to make those decisions in one country, and why would it not be suitable to make those decisions in another country? Because when I read the quote that one minister can make such an important decision, the average citizen doesn't know that. The average citizen has no idea why certain decisions are being made, and I think, once again, going back to the democratic principles, it is good for the citizen to know why such impactful decisions are being made regarding their health. Thank you for your attention. Are there any decisions? Are there any questions?
Look into the room. Yes, Maaike.
Would you think that if we had the same testing strategy all over Europe, the pandemic would have gone completely different in Europe?
Well, I think that's a very difficult question for me to answer. But I think if the idea is correct that it is important to test as soon as possible in order to take the necessary precautions, yes, I think perhaps it would have been different, because I do think in some countries it took months for them to develop a mass testing strategy. So on the premise that it's important to test, yes.
Okay, Betty?
I don't know whether it's something that we're going to discuss later on, but you mentioned that the systematic review and then the research on the statistical strategy that are the same sectors that come forward. So apparently, some we didn't learn anything in during COVID-19, or they were important. But what is there anything that you know because we noticed this? Is there anything that you would say, okay, this is because the laboratories are not one of the most important sectors, while they are essential in developing testing strategies. So is that something that you would the findings of this study to take on board in discussing, for example, with policymakers or the ones that have to develop the overall conceptual collaboration plans that have to take that on board?
Yeah, I think so. I think perhaps it's difficult to say that we didn't learn from previous public health emergencies, but we asked the national focal points or extraordinary national focal points, and of course, I think they have their experiences and the people that they usually connect with to make the certain decisions. It's also very interesting. We asked the respondents of the survey, are there other sectors that need to be involved? Would you have done it differently? And most actually said that this was fine, how it took place. So there is this idea, on the one hand, that is often stated, we need more multisectoral collaboration. But when you ask specifically, was this okay, how it was done, with actually not that much multisectoral collaboration, or at least not from sectors that you would not have expected, in general, the national focal points thought it went well.
Then I have a last question from my side, because you talk about this one individual, one citizen who had such an influence, and that it is important to take the community with you. I was wondering, I heard a quite critical tone. Well, I think this is leadership. It was a minister, so I think there's a lot of criticism that there is governance and lack of leadership. So I was wondering were people not happy with it? And the second thing is also with communicating. I mean, there are a lot of communication done by leaders. So I was wondering, why are you critical about this aspect?
Because I'm critical about this aspect because he made the decision that was in favor of what was being said internationally, but he could have apparently also done the other way around. If one person can say, this is how we're going to do it, if no one else is going to do it, my ministry is going to do it, I find that quite a tricky statement.
Okay. Well, because it can be just the law that there is central governance and that it's only the minister who is allowed to make such a decision.
That could be the case, but like this minister didn't actually think it was his ministry that should have been doing it, but he said no one else is doing it, so we're going to do it. So in that case, perhaps the experts who should have said, okay, this is how we're going to go from here, they had not made that decision till yet.
It has a lot of aspects, that's clear. Thank you very much, Sandra.